our next speaker. It's an honor and pleasure to have Dr. Batra here, who's a good friend and colleague, and certainly an expert in skin cancer. So thank you so much, Sonia, for being here today.
Thank you all for coming out on a Saturday. I'm Dr. Sonia Batra. I'm a board-certified dermatologist and board-certified micrographic dermatologic surgeon. And I really appreciate the invitation from Dr. Essner and the St. John's Cancer Institute, as well as AIM Foundation for Melanoma. By a show of hands, how many of you are here because you personally have been diagnosed with melanoma? So quite a few. And then, but of those in the room, who are here to support a family member? So also quite a few, so an even split. How many of you have heard you should use sunscreen? To all of you, and I assume all of the virtual audience as well. How many of you have actually had a doctor sit down and tell you what to look for in your sunscreen? Zero, right? One, two, not that many. And I'm sad to say a couple of my patients are in the room and they're not raising their hands. So that's not my favorite thing to see. But I'm going to go through and talk to you a little bit about what to actually look for from a dermatologist's perspective. And it's, I hope, a little more informative than going to Sephora and just telling them you need a sunscreen. So I'm going to walk through with this, and I hope there will be time for questions. I'm going to try to make up a little bit of the time so there's some time at the end. But my task is to talk to you in a little bit more detail about sun protection, which we throw around as a term, sunscreens. And then, of course, I think many people going through the newer standard of care for melanoma, and I'll defer to my colleague Patty to talk to you about this in depth in terms of toxicities. But I do get a lot of questions now that people are on immunotherapy as to how to best protect their skin and manage some of the skin sequelae. So I will delve into that a little bit as well. But we all have heard really elegantly from my colleagues, especially Dr. Hu this morning, about melanoma risk factors, and Dr. Pincus as well. The things we can't control, obviously, are the number of moles we have, our genetic makeup, whether we have light, like blonde or red hair, or light eyes. But the two things we certainly have control over are early childhood burns and intermittent adult burns. And so it's something that we can really talk about because there's a lot of things we can do. And the other aspect is you just heard very elegantly about this question about vitamin D and retinols. And if I have time, I'm happy to address those, because I think one thing you should hear from a dermatologist is it's not the sun that's the enemy. Okay, we're all in favor of vitamin D. It's the burns that are the enemy. So knowing how to protect yourself, 5 to 10 minutes of sun exposure 3 to 5 times a week, no one is going to quibble with that. And certainly no dermatologist who practices in Miami or in LA is going to be against the sun, but we're going to tell you, just don't go out there and turn red. Don't accrue the damage that turns you pink or burns, because that's where you're going into a higher risk zone. And so you've also heard about this, about childhood burns more than 5, that intermittent intense exposure to ultraviolet light, and certainly using a tanning bed, which is a little less common in places like LA, but it still happens. You'd be amazed how many people I see in my clinic in Santa Monica who come in and tan before they go to prom. And you're thinking to yourself, you live in Santa Monica, really? Is this necessary? But it's still prevalent. So really addressing that with people, especially younger people, because melanoma is sadly highest impact in our younger populations. It's kind of good to have that on the radar. So, one thing I'm often asked by patients, and I think Dr. Hu was talking about this as well, is that we've made so much progress in cancer research. Why is skin cancer one of those ones that every time you look at the chart, really depressingly, is going up? And I always just go back to these habits, and these are things we can control, because sadly, people really have increased their exposure habits. We spend a lot of time outside. This photo is from Sydney during the COVID lockdown. And this is how many people were still on the beach in violation of quarantine restrictions, which were quite strict in Australia. And we're out there. Everybody's out on the beach, outdoor activities. They're not necessarily protecting themselves, and I'll delve into that. The other thing is, sadly, as our environment is deteriorating, the ozone layer is thinning. So we have 10% more of those really damaging ultraviolet rays that cause those free radicals and that oxidative damage that Ashley was talking about in such detail, reaching your skin and damaging it and leading to some of the changes and mutations that sadly not only age you, but lead to skin cancer. So thought it would be worth mentioning. And I think the other aspect of education when we talk about skin cancer and cancer prevention from a skin cancer perspective is that it's not just sun avoidance, because that's not realistic, but I think that should be on there. And what I mean by that is being able to structure your life in a way that minimizes the peak hours of ultraviolet exposure. talking about sunscreens, and I'll delve into ingredients. I'm an ingredient nerd, so I'm happy to answer questions about products afterwards. Certainly hats, which very fortunately are much more fashionable than they used to be, because I'm going to show you some examples of great hats I've found online. Sunglasses, because the other thing we're not talking about today, but we did briefly mention that BAP1 uveal melanoma connection is ocular protection, because I am seeing that much more in my population now, sadly, here in Southern California, where ocular melanoma used to be extraordinarily rare, and now I'm sadly seeing more of it. And I think that is directly related to the ultraviolet component. And then, of course, self-exams, not just relying on those hopefully 3, 6, 12-month checks with your doctor, but really familiarizing yourself with your own skin. Pick a window. If it's once a month, give yourself a once over, and list your partner if you have one, and just look for those changes. Because while it's really cool to go in and have the software to detect that new mole, I'd say about 50% of the time it's my patient who'll come in and say, I never had this black spot, and then I just saw it on my calf, and I'm like, oh, that goes. And so that's really extraordinarily helpful for you to be really familiar with your skin as well. And this is a great photo because I think it contrasts with that image I just showed you from Sydney. This is the Australian Public Health Initiative. And because they've had such a high incidence of skin cancer, they've really impacted and improved upon public outreach. And this is one of the photos they're showing of a kid on a beach, super covered up, playing some version of a didgeridoo, which is very Australian, and with an umbrella. So I always kind of smile and think, like, I wish we all were educating our children like that a little bit more. And hopefully educating people that this is not cool, okay? Please don't go out, lie out, fry yourself. These images are still pervasive in the media. I just did a Google search like 2 days ago before I put together this talk and these slides. And these images are everywhere, the glorification of being out there, being brown, being burned, being tanned. And I think we just really need to educate ourselves. And like I mentioned, that pre-prom tan, not my favorite. And here in LA, a lot of pre-red carpet tanning as well. So, just kind of making sure that people know that's not a good idea. When we talk about peak UV index hours, this is pretty strict, 10 a.m. to 4 p.m. If that's not realistic to put your tea time or your walk the dog time or your outdoor time outside of those hours, then at least aim for 10 to 2. But that's when we know if you're out, you're going to accrue much more exposure and much more damage. If you have a choice and you can stand in the blinding sunlight or you can stand in the shade, stand in the shade. Obviously common sense, but you'd be amazed how many times I've been at school events for my kids and I'm kind of trying to redirect people into a shady part of the yard when things are going on. And it just didn't even cross people's radar that that's a really simple, really easy thing to do. And then I think whenever I talk to my patients about protective clothing, and any of you who've looked at it in the last 20 years, it was pretty scary. Like early on, protective clothing was suffocating and ugly, and nobody wanted to wear it. And I think, fortunately, in response to the fact that skin cancer is the #1 cancer of any type in the United States, very smart entrepreneurs have realized that there is a niche for fashionable, wearable, sun protective clothing. And you don't have to go out and spend a fortune. You can find it at Old Navy and Uniqlo and kind of common brands that are inexpensive, but super helpful to know that even if you don't go out and buy something specifically labeled as sun protective, just put whatever fabric you're holding up to the light. If the light doesn't pass through, it is protecting you from ultraviolet. And that's sort of common sense, but it's good to hear because I think many of us, wear a floppy hat that's mesh. And then when the light is passing through, wonder why they're still burned. So it's just, if it's transmitting light, then ultraviolet is getting through. This hat that I have a photo of, I found this online a couple nights ago. You can get it for $16.95 from Amazon. This is what most people think of when I say, oh, get a hat. It's going to protect you from the sun. I can assure you there are many, many better, more fashionable options out there. Just ask any of my kids. I'm always spotted in the bleachers with my big fancy hats. And usually I feel like my small contribution to public health is all the other moms like, where'd you get that hat? And then I, give them a referral. But there are many more fashionable ones, and they're well worth investigating if you're not willing to wear this umbrella on your head. So in terms of what to look for in sunblocks, this is also good to hear because everybody can tell you to wear sunscreen, but if you're wearing the wrong one, it's not helping you in any way. And the other thing is that people have this perception they only need sunscreen when they're going to be out and sitting at a park or sitting on the beach. And I tell my patients here in Southern California, rain or shine, put it on. You're going to be in your car. You're going to go run that errand and you're not going to realize you're not protected. So find a daily moisture with sunscreen. And it doesn't have to be anything fancy. It just has to be something you wear. In fact, preferably not $400 an ounce from Neiman's, because you're going to like use such a tiny amount of it because it's so expensive that it's not going to afford you the protection you need. So the other thing that a lot of my patients don't realize is that that term, sun protective factor, SPF, only applies to UVB. And on my first slide, I showed you the kind of two primary wavelengths of ultraviolet that we're concerned about. And while UVB is the narrower wavelength that's more carcinogenic, we do know that the longer wavelength UVA is really damaging and actually penetrates more deeply because it's a deeper, longer wavelength of light. So if you are going to buy a sunscreen, make sure it says somewhere on the label that it's broad spectrum, because that means it's protecting you from both of those aspects of the ultraviolet spectrum. It's not just the UVB. And I am a fanatic. Any of you who are my patients hopefully have heard that physical block sunscreens are just more reliable. They're always broad spectrum, so you're not worried about what part of ultraviolet you're protecting yourself from. They're less allergenic. They're safer in kids. There's a myriad of reasons to always look for that micronized zinc oxide and titanium dioxide product. And I always tell my patients, just be an informed consumer. Turn the bottle over, look at that line that says active ingredients. And if it says anything other than zinc or titanium, please don't use it, because there's a lot more question marks about the chemical block sunscreens. And I've been saying this probably for 2 decades now as I've been practicing. And interestingly, in the last 5 years, I work a lot with the media, and we've done segment after segment on how we're learning so much more about the systemic absorption of chemical block sunscreens, how many of them degrade to more carcinogenic compounds like benzene. So I feel really vindicated, because for 20 years I've been advocating mineral sunscreens, and now I'm finding out that there's more and more data to support that. Apply a lot of it, and I'll go into that in detail in a minute. And then certainly the other thing that many of us fall short is, even if you're great about putting it on before you leave the house, reapply if you're a swimmer, if you're sweating, if you're wet, and reapply every 2 to 4 hours, even if you're just out and about and you know you're going to be back out in the sun. And in terms of how much you need, because this is a common question, is a higher SPF actually better? It's kind of interesting because that curve really plateaus. The difference between an SPF 30, which is a 97% UVB block, and an SPF 50, which is a 98% UV block, is not that much. Now, however, if you've had melanoma, that delta, which is still 50% in that window, is probably worth it to you. But for the average person, going out and spending more money on a higher SPF is just not worth it. Like, anything over 30 is kind of icing on the cake. If you're at that 30 mark, you're still getting a 97% block. And I think that's really good. And in terms of what I was getting at, why I'm a fanatic about physical versus chemical sunscreens, is this is a really good schematic. Physical sunscreens are minerals that sit on top of your skin and deflect ultraviolet light. So that UV never penetrates and gets into the skin. The way chemical block ingredients work is the ultraviolet is absorbed in your skin and converted to heat through a chemical reaction. So in general, when you think about it intuitively, it makes a little more sense to just put on a shield and go. It's going to work instantly. You don't have to have that 20 to 40-minute lag you should use if you're using a chemical sunscreen to get, adequate protection. And like I said, you worry a lot less about longer-term toxicities of chemical products. The other thing I always tell my patients is sunscreen's only going to work if you use it everywhere. So this is a common scenario in my clinic where someone tried to remember to use it and sadly didn't get full coverage. So, just a good reminder about putting it on more widely or enlisting someone to help you. This is what I was alluding to. How much is, sunscreen and makeup is never enough. And very few of us apply enough makeup to actually achieve the SPF on the label. It's not additive. If you're using a whole bunch of SPF 5 or 10 products, you only get the SPF in the highest number that you applied. And the other thing I tell patients, and especially anyone who's a melanoma survivor, is don't forget lip balm, because we don't have as much protective melanin in our lips. And a lot of times we use gloss. So it's just like the good old days when people put baby oil on and it improved the absorption of light. You definitely, if you're wearing a lip balm or a lip product that is sun protective, try to get one that's matte, because it's going to, the gloss is going to decrease the scatter of light. And so I'm going to change gears a little bit and just talk very briefly about skincare during therapy, because many of you actually have had melanoma and you may have been through immunotherapy. And so this aspect of skincare has actually changed a lot in the last 10 to 15 years as melanoma treatments have evolved. And so it's interesting. We used to have a lot of toxicities that were the more classical chemo issues, where people would come in and ask me how to preserve their hair, and the more standard things when you're using cytotoxic things that harm the cells. Now, because we have this new advent in melanoma of immune checkpoint inhibitors, which basically take the brakes off your immune system, a lot of the things I'm seeing are because your immune system is more active in your skin. And that leads to a whole different range of skin sequelae. So I'm just going to very briefly, and I'll defer to Patty to talk to you in depth about some of the other aspects of these medications and their toxicities. But it's sort of common sense again, just like I was talking about sunscreen. If your immune system is in overdrive, the less target you give it, the less irritants you give it, then the better off you're going to be. So if you already know you're using an immune checkpoint inhibitor or have a loved one who is, the more hypoallergenic, fragrance-free, color-free your skincare regimen can be, the better. So really gentle, not too long, not too hot showers or baths. Scent-free, dye-free, everything from your laundry detergent to your cleanser to your moisturizer. Like the more you can take away things that are irritants, the better you may fare in this kind of a treatment regimen. And then the other thing is the skin's function as an organ is to be a barrier. It's to be a wall against the outside world. Like your heart is designed to pump, your skin is designed to seal you from all the irritants and things we come in contact with in the universe. And so it sounds really cliched as a dermatologist to stand up here and tell you to use moisturizer, but it's actually a really good thing because it's going to seal your skin and prevent some of those irritants. So it's not just because we want you to buy a bunch of products. And then this is a really busy slide. You don't have to memorize everything, but these are kind of common things now we're seeing in the dermatology clinic because of immune checkpoint inhibitor therapy. And what this translates to when you come into my office is you're going to say you're itchy and you have a painful skin rash. And so this is because the immune system has gone into overdrive and now it's reacting to all those things. And so when we talk about our armamentarium, as a dermatologist, I am always going to go to the regimen and the topicals first. And Patty can also speak to this because there is a little bit of controversy, right? If you're trying to unleash your immune system on your tumor, you don't want your dermatologist putting you on something that suppresses your immune system to calm down the rash. So that, like a systemic steroid, is a little bit controversial and usually my last resort. But we do have a whole arsenal of anti-inflammatory creams and topicals. Sometimes the topicals are steroids. We have many newer tools in that armamentarium, certainly antihistamines to keep you from being really itchy. And then the really new sophisticated anti-itch medicines as well. In the worst case, this is my last resort in someone who has a history of melanoma, we can even use light to disperse inflammation in the skin. So it's good to know that there's a whole arsenal and an array of tools we can use if you find yourself in the unfortunate situation of having a skin reaction to your melanoma immunotherapy. So thank you very much for your attention. These are my two kids and two koalas in Australia, where I've learned a lot about skin cancer management. I appreciate all of your attention. I'd be happy to answer any questions. My email is up as well.